Okay, great, we're on. 7 o'clock, LCTV is going to be doing question and answers with town officials and people that work around town, small business people, just areas of interest, just to show some content during this time. Of course, one of the most important things to do is to talk to our emergency people from the emergency management team in town, and that's Chief Frank Freitzel and Chief Benjamin Sargent, Chief Sargent. And we are going to take questions from the folks who comment and question on Facebook, if they do, if they're nice comments. And if they're intelligent questions, we'll read them. But we have some questions of our own. We'll start with Chief Freitzel. Just talk about what the emergency management team does. What have they been doing since this has started?
So the emergency management team is comprised of the emergency management director, which is a position that I hold in addition to being the fire chief, a representative of the fire department, which is typically Deputy Doug Nickel, a representative of the police department, typically Ben Sargent or Captain Scotty, the chairman of the board of selectmen, the town administrator, the finance director, the town clerk, the library director, the highway director, solid waste director, and a representative from the school department. And we started meeting right after the 1st of March, when things really started to break. We met in this very room for our first meeting on a Monday, and have subsequently had conference calls, teleconference calls or video conference calls each Monday, Wednesday, and Friday since then. And those are done in the afternoon after the state Department of Homeland Security does a noontime conference call for emergency management directors and public officials at noontime on Monday, Wednesday, Friday. So we timed our emergency management team meetings to coincide with the HSEM meeting, our conference calls, in order to bring that information back. We then discuss the information shared by Homeland Security and the various departments, Health and Human Services, FEMA, so forth. And then any issues or challenges that the individual departments are facing, they bring them forward, and we work through them as a management team. Early on, the emergency management team was instrumental in crafting the recommendations for the Board of Selectmen's directives on park closures and so forth, building security and safety. So basically, that's kind of the role of the emergency management team. We've, as of today, kind of moved our meetings to once a week because things have, I don't know if stabilized is the right word, but things are not as rapidly changing as they were early on. Conference calls tend to be a little bit shorter at the state level. And now we're starting to move towards, actually, Friday's conference call is on the reimbursement program and how the town can apply for FEMA funding for reimbursement for the costs incurred to deal with the COVID-19 issue.
Excellent.
We've actually had several items that have come up within town that have been shared to Homeland Security for inclusion and policy set by the state. And probably one of them is that we brought forward, came from our town clerk, Terry, marriage licenses. Nothing was addressed in the governor's initial executive order for marriage licenses. And once venues were shut down for groups of 50 and then subsequently groups of 10, she had a couple of people call looking for a JP in order to perform marriages because the license is only good for 30 days. I brought that forward in the next conference call, and that was included in one of the directives from the state, in one of the executive orders, that marriage licenses would be basically valid for, I believe it was 30 or 60 days, I don't recall now, after the state of emergency ends, so that people don't need to rush out and find a JP just to use the license that they have. So that's the type of things that the meetings bring up. And basically, we're working collectively as a team. And I did mention school district, but the school superintendent and/or the business administrator, Corey Isbicki, have been involved from day one. And we've shared information back and forth, what the schools, so that we're kind of in lockstep with the school district and what they're doing. So,
Excellent. Anything you want to add to that, Chief Sergeant, as far as your role, your department's role has gone on since the management team has been rolling?
I think the most important thing to take away from it, and it's a positive note that speaks to our department heads, is how well we can work together. It's been great to exchange information, thoughts, and ideas with various department heads and create solutions to meet the needs and the safety of our citizens. The fire chief has done a great job coordinating these meetings as the emergency management director. Our IT director, John Brunell, is able to establish a platform where we can meet safely, remotely, and conduct the business necessary to meet the needs of the town. So I'm really proud of the group, proud of the direction, and proud of what we've done so far.
Excellent. So I've had some talk about this, and once the COVID-19 map started showing how many cases per town, a lot of people have been asking questions about that sort of thing, and they're nervous about if their neighbors or something happen. How does your departments get informed that somebody has tested positive? What's the chain of command for that, as far as it goes from like the hospital to the state to you? I mean, you have to know where they are. We're not asking you where they are, but there has to be some sort of chain of command for that. What is that?
So the map that's published, and it was just released within the last hour for today's update. That map is cumulative, meaning that every positive test since we started this in late February is included in that number.
Right.
So we're in the 10 to 20 bracket, or 25 bracket. I don't recall what it is, but we're in that bracket. That does not necessarily mean we currently have 10 to 25 people that are presently dealing with COVID. It means we've had that range of people that tested over the period of time.
Exactly.
Many of which have subsequently, recovered and are fine today. The state did work through the Attorney General's office with police chiefs and fire chiefs and the state's emergency 911 communication center to address the need for that information for the protection of first responders, and keeping obviously the HIPAA laws, medical laws in mind, but recognizing that the unnecessary exposure to police, fire, EMS could put those agencies at a severe deficit if all of a sudden we lose, 3, 4, 5, 6 people on a fire department, a couple of 3, 4, 5 officers to being isolated. That has a severe impact on any community, particularly a smaller community. So in trying to balance the compelling needs, the state was able to work out within the laws and within the Department of Health, the Attorney General's office, and so forth, a protocol where an address, anyone tested for COVID-19 that tests positive, that results come back positive, the address they gave when they were tested is entered into the E911 database in Concord for a period of 21 days from the date of the test. That information shows up automatically if that residence or that address calls 911. The telecommunicator in Concord will then relay to either our police department's dispatch center or Hudson Fire, which dispatches for us, that a certain protocol or precautions are necessary at that address. So not necessarily a name, but that address has been flagged as having someone who's tested positive, so that we know going in, whether it's a police or fire matter or EMS matter, that we need to take the necessary precautions. And that's, again, for the protection of everybody. Mm-hmm. We subsequently, in addition to that, because not everything is initiated through 911, more so on the law enforcement side, not all of their calls, probably very few of their calls come through 911. Police and fire department chiefs specifically are allowed to get a list of addresses on a daily basis, so that if they're going to deal with a matter that didn't come through 911, they know ahead of time that address has a positive test there and can take the necessary precautions. If we're going out to do an inspection or some type of a non-emergency, we have the knowledge that there is something there. That address falls off that list automatically after 21 days. So, and we have both signed, Chief Sergeant and I have both signed memorandums of understanding with the Attorney General's office that we are not allowed to divulge that information.
Right.
So,
Necessary precautions. I'll just ask you, because you've talked about it. So you get a call from one of the E90, E911 houses that are tested positive. I know Litchfield doesn't have an ambulance per se, but they have a rescue squad that comes to the, some of the on-call guys will come to the station, get a truck, and some guys will just meet them there.
Mhm.
What are the changes, like if, as opposed to a normal call, as to a C19 call?
so because so we're treating pretty much every call with precaution, just because we don't know. We know the address is flagged, but that doesn't mean anybody in the, at every other house hasn't been tested.
Mhm.
Because of the minimal amount of testing done and the studies that, believe there's a certain percentage of people that are carriers and just are what's called asymptomatic, not showing signs or symptoms. We treat every call where there's any type of flu symptoms, any type of difficulty breathing or key triggers. And even to a degree, somebody that's fallen and starts coughing could potentially be infected. So what we have done is we've changed our protocol that we send one person to assess and hold the others back outside until such time as either we've got a mask on the patient if necessary and so forth, so that we're not risking putting everybody in at the same time and all of a sudden realizing, okay, there's an issue here. Police department is still responding to all medical and fire-related calls. However, they're waiting outside, where typically they've come in to lend a hand, whether it's carrying a stretcher or whatever. They're waiting outside unless it's a matter that they need to go in, and so forth. So, and we've done the same, and I know you've got a question later on. We've done similar on fire-related, non-medical incidents. So, and I think the police department and certainly Chief Sergeant can speak to how they've addressed changes in protocol and procedure.
Yeah, Chief Sergeant, I'll ask you about a protocol on a call, but before that, there's no surprise, there's no secret that your department, the room issue, you need more room. You've needed more room over in that area for a while now. The last chief has spoken about it. You kind of cramped in there, but now with the COVID-19, what are the kind of the changes that you've made inside there to kind of maintain social distancing, having your officers show up for work and go directly into their car and take off? I mean, what are the changes you've made since COVID-19?
I think the biggest change as a department was closing down the front door to the town hall to the police department, limiting that face-to-face contact with a dispatcher and an officer. So we are trying to reduce the amount of people, if at all possible, that come into the police department. That's accomplished by handling calls that we would normally respond to a person's home or invite them into the station and into a much more condensed interview room to speak with them, take a statement. Those types of calls are taking place over the phone, via email. For the officers, we have a lot of hand sanitizer throughout the whole facility, Lysol disinfecting spray that they can spray their boots down. They can spray the common areas. We've utilized, and with the permission of the town, our custodian is in nightly doing a deep clean, spraying all the door handles and other common areas that are touched. We worked out an agreement with the fire chief that they have allowed us to have access to the fire department in the event that an officer has a potential exposure or needs to get out of their uniform, take a shower. We're able to use their facilities. and go into a contamination room where they can remove their uniform, put it right into a commercial grade washing machine, and then move into a clean room for a shower. And then, Chief, and you could speak to it better than this, and then move into another room where it's non-contaminated and they could put on their uniform again. So that was a great gesture for the fire department to allow us access so our officers can maintain their personal safety and health.
Must make them feel a little bit better too, that they have an option.
They were really excited
They don't
about
have to
that.
freak out. What am I going to do? So what about on a call? I mean, has that changed anything? I know a later question we had was, I think the Telegraph or the Union Leader had an article about domestic violence calls going up, and this with people being quarantined and staying at home and getting on each other's nerves. This, other calls, when you go on a call, what are the, if any, changes you've made since the COVID-19 outbreak?
So one of the biggest changes is we're trying to ask people to come outside of their home, where normally we would be invited into the home. We'd speak to multiple people inside of the residence. We're trying to have more contact outside. Again, we're keeping a greater distance from the people that we're speaking with. We're also wearing personal protection equipment when we're speaking with people. So sometimes that's a surprise to see an officer wearing goggles and a mask, and gloves when they respond to a simple theft report or whatnot. In terms of the domestic violence, and we can speak to that on another issue, that's an unfortunate truth and a reality of the situation is that there has been an increase in town of domestic violence. And more concerning to me are the nature, the level of these offenses. We're seeing felony level domestic violence crimes being committed during this time.
In the town.
Correct.
And that's something that we don't usually see as far as the level and the amount goes.
Correct, sir.
Yeah. All righty. So far, so good. No, painless. Nobody's commented. Nobody's had any questions. So here's their chance, folks. There's your chance to ask questions. If you had any question about what's going on, I know a lot of people demanding to know if their neighbor has COVID-19, and I think we've answered that question. That's not going to happen. But any other questions or comments about these guys, their departments, and we'll read those. So you kind of talked about this about on a call. You don't limit the amount of on-call guys, or if it's a fire call. Do you have the same amount? Do you call the same amount to come get apparatus, or do you just say, all right, one guy's going to bring everything there and we'll just meet you there?
So we have not restricted the number of, this group can respond to today, this group responds tomorrow. What we have done is, in our apparatus holds anywhere from 2 to 6 personnel. So we have in the smaller apparatus that may seat 3, we've limited it to 2, and not to shorthand staff, but to keep a little bit of distance in that apparatus. So rather than being shoulder to shoulder, you've at least got a foot or two. There's obviously no way to get 6 feet, but again, to try and create space where we can possibly create space. In our engines that seat 6, we've limited it to 4 to again try and keep some space. And if we need to get additional personnel there, we'll get additional personnel there. But what we've done is treated it very much like a hazardous materials incident, where we put the minimum amount of people necessary initially in to assess and evaluate, and then they advise what they need for additional equipment or manpower or so forth. We've actually worked it out with Hudson, because the Hudson, the ambulance is going to transport. Those 2 or 3 firefighters on the ambulance are committed to that patient if they're transporting. So rather than if we're in the south end of town and the ambulance gets there at the same time, the ambulance crew will go in and they have their protocol. They're working similar. They don't put the whole crew in. They minimize contact. To the chief's point, when we can, we'll ask a patient to come to the front door and meet us outside if they're able to. Obviously, that's not the case in a lot of situations, but if they're physically able to come outside and we don't have to go inside to treat them, we'll do that. We'll ask them to come out so we don't put somebody into the house. All our personnel have been issued masks, goggles, as the police department has masks, goggles, gowns, so forth. But what we've basically done is tried to limit the risk to personnel, but not limit the response or, compromise the level of care. So on a fire non-emergency related incident, instead of sending a crew of 4 in, we'll send a crew of 2 in. They'll assess the situation. If it's obvious they need all 4 right off, all 4 are going to go to work. But rather than put all 4 in, then realize we've got a situation, and now we have potentially 4 firefighters that have been exposed and are going to be subject to quarantine. We try to minimize it as best we can. But again, unfortunately there's no playbook for every incident, because every incident is unique in its own way in both disciplines. So
Yeah, that makes me think of another question. I'll ask Chief Sergeant first. Say you get 3 or 4 officers infected. Do you have enough personnel to go forward and to replace them for a 14, 20-day period? How close to me the town, I think, is fully staffed as far as, you probably like a couple more officers, but we'll get into that. But if 3 or 4 officers come to a place and they all get infected, somebody coughs on them, and they got to go through the whole thing, do you have enough personnel to be able to maintain the level of work you guys do?
Certainly, I think that would be a significant hardship for the department when we talk a number of 3 or 4. At this time, we're not full staff because we do have 1 officer who's deployed. There would be a big impact, and we would have to get very creative in order to provide the same level of service to the town.
Do you want to deputize me or Russ?
We'd love to have you on the team.
I think I can do 1 push-up
All right.
in a day. I know for a fact the Ford Explorers, the seatbelt won't fit me. So other than that, you think I'm a good?
Well, we got the Chevy Tahoes as our
They'll
frontline
fit.
vehicles,
That'll
so
be perfect.
that'll
We
work
have the
out
same
good.
trucks at where I work. And speaking of the trucks, at the end of the day, at the end of their shifts, do they take them home, or do they have to completely disinfect them for the next guy or gal? Or do they, because where I work, they just said, take them home, it's your car, until we tell you it's not your car. How you guys handling that over there?
So we do have some officers who do have to share different vehicles. They are assigned to 1 vehicle, and they are responsible for disinfecting the cruiser at the end of their shift. And the officers, I can't speak highly enough for how well they've done about taking that very serious, taking the extra time to disinfect. We had a great opportunity presented to us by a local resident to the chairman of the Board of Selectmen, and the fire chief can speak to it, for a local company out of Hooksett who was willing to provide disinfection of emergency apparatus, fire trucks, and police vehicles. The police department at this time has not had the opportunity. We're hoping to next week get our vehicles cleaned. The fire chief can speak to his experience, as earlier this week they took advantage of this free service provided by this local company in Hooksett. And Chief, if you want to speak to that?
Before you
Yes.
do that, if it was not free, and say you needed more than just their help, and you needed to, the town needs to go out and contract cleaners, is that something that the FEMA funds could eventually reimburse? Is that something that falls under that category?
So I would hope so. We have been told from pretty much the beginning, from Homeland Security and ultimately FEMA at the federal level, to account for all costs related to this pandemic. So we have been doing that since the end of February. Each department head is tracking, whether it's additional cleaning of the police station, additional cleaning of the fire station, sanitizing of vehicles, masks, gowns, eye protect shields, anything that's basically tied to that, we've been accounting for. And finance department, all the department heads have been reporting weekly. Finance is keeping track of that. And then starting this Friday, State Department of Homeland Security is going to be providing conference calls to finance directors, town administrators, and finance officials on what's eligible, what's not, how to go about filing the paperwork, and what records need to be maintained and submitted for reimbursement. Presently, under the current grant approval or emergency declaration approval, reimbursement for those costs will be at 75%. So the town will incur 25% of whatever the end cost is, and the federal government will reimburse the town for 75% of it. The state is trying to get, better than 75%, ultimately, obviously 100%, but that remains to be seen. But as of right now, under the current guidance, the town will be reimbursed for 75% of all eligible costs. So we are tracking that.
Right.
And yes, if we needed to have something professionally done, that becomes a department head decision to make to get it done. So
That's excellent to know about the funds and the company in Hooksett helping us out. We got a few people who have commented. Amy Zellers, please thank them and for their service. Of course, guys. I mean, who knew what you were in for when you decided to take the job? But I think everybody in the town can say that they feel that when you guys and their departments are here, we feel safe and we feel like we are being protected. Barb Town says the same thing. Both departments are doing a great job. Thanks for your service. Stay safe. There's a question from Jay Sweeney. You guys need any PPE supplies? And if you have a need, there's lots of people making masks and stuff out there. How's their PPE supplies? We'll start with Chief Sergeant.
Well, thank you for the thank yous to the departments. I've stated before, it's an honor and it's a privilege to serve the community and the great citizens and local businesses. So thank you for taking the time to reach out and send those messages. It means a lot. It means a lot to the police officers and I'm sure the firefighters as well. We are in a good situation on the police department side with our PPEs. We were able to get some product from the state on 2 different incidents. The fire chief has been able to provide us with some additional PPEs. So from our standpoint, I'm pleased to say that we're in a good position with a good surplus. But thank you very much, Mr. Sweeney, for inquiring and for making sure that we have those essential PPEs.
And we're the same. And we've both Ben and I and Tom and I and Deputy Nickel have had daily basis. We're all in contact and we're sharing whatever we need to. As he alluded to earlier, we're sharing not only equipment, we're sharing resources. We're all in this together and we're going to do what we need to do to work together. We are pretty well set. We're fortunate. We're not a transporting agency, meaning we don't have an ambulance where we're burning through a lot more equipment. Based on, we look at, what we call a daily burn rate, what we're using on a daily basis. And based on the last 4 to 6 weeks, we're good for the next 4 to 6 weeks. We have the ability to request equipment through the state. We've had some folks donate. I was cleaning my workshop. I found a half a dozen N95 masks. They've donated them. As Chief mentioned earlier, Soil Away out of Hooksett has done for a number of departments in the southern part of the state, police, fire, EMS, sanitized vehicles. We did send 5 of our apparatus up there, our primary apparatus up to Hooksett on Monday. And in the course of 3 or so hours on Monday, they did sanitize five of our apparatus at no cost. So, was there a cost to the town? There was a cost of a couple of people, for 3 or 4 hours to drive them back and forth. But in comparison to what we get, we benefited. That's a small price to pay for the safety of our staff. We were also fortunate enough to get a case or 4 gallons of hand sanitizer donated by a company out of Derry that was originally in or is typically in the beauty supply production business. They switched over several weeks ago to making 70% alcohol hand sanitizer. And they donated a case to the town and departments on Monday. So we've obviously shared it with the PD. If town hall needs it, we've got it. And any other department, we have that available. So that really bolstered our hand sanitizer supplies. And again, the state on every conference call, you know, the Assistant Commissioner of Safety reiterates that if you need equipment, let us know. We may not get you everything you need, but we're not gonna leave you unprotected. We'll get you, you know, what you need. And I'm sure people have seen that, you know, the state has really done an excellent job to acquire, as a state, acquire PPE, personal protective equipment. And even on today's conference call, Commissioner Plummer stated that we've already had 2 planes come in. Dean Kamen chartered the first one and acquired the first 100,000 pounds of PPE. Another one arrived this past weekend. There's 2 more planes due into New Hampshire in the next week. So I think, you know, that will hold us for the foreseeable future. And again, we're looking at our daily burn rate and where we go. And you know, obviously, if we run short and they've got some to loan and vice versa, what we have is the towns, and we're going to use it for the town, not necessarily an individual department. And if I can just jump back again to the thank yous from the residents. Thank you to the residents on behalf of both departments in the town for the support. You know, we're all in this together. This is not, you know, we've been doing our jobs a long time. This is nothing that I have ever worked through. So, you know, it's to a degree where you know, we're creating this plan as we go because we don't have the answers. Nobody has the answers.
Right. So they're all set with PPE, everyone. However, you want to bring the cookies, the pizzas, they're not going to ask for it and they're not going to say anything, but the cookies, the pizzas, the well wishes, the cards from the kids, anything like that, keep doing that. That's fantastic stuff. We got a question from Dave Cady asking about the river access. Is that closure COVID related, or is that just at the time of the year type of thing?
Guess I wasn't aware of the river. I know we've been dealing, so I guess I'll preface it with, I know we've been dealing with some medical waste and biohazard concerns, particularly in the north end of town. So a section of that may be closed because of that, because of reoccurring issues with high water levels and so forth.
Right.
But I'm not aware that it's
I think
closed.
it's the gate. It's probably just because the gate's locked and, you know, all day long. So it's probably what he's talking about.
Which
Whose jurisdiction is is it the rec department? Is it,
so conservation.
Conservation.
So like Morris Falls or Morris Falls.
yes.
Sorry, wrong town.
Yeah.
Is conservation, but ultimately the Board of Selectmen.
Mhm.
So, I mean, the goal was not to necessarily shut down recreation areas, but minimize the grouping.
Right.
You know, and so, you know, if people want to take a walk, as long as they're practicing good social distance and so forth, there's no prohibition about that. But a
Right.
basketball game or a football game where there's contact and so forth, that just totally is, you know, goes against the CDC guidelines and so
Right.
forth. And so that would be a concern. Playgrounds, we did close because there's no way to keep them properly sanitized.
Right.
So, but as far as bike path and, you know, the conservation type, to the best of my knowledge, all the state park trails and everything are being used on a daily basis, regular
State,
basis.
yeah, I know.
Town forest,
Town
state,
forest, yeah.
Muskwa,
Yeah.
is being used on a more so than ever, from what I'm told.
Yeah, they're pretty crowded. I mean, I think people are being responsible, but they're more crowded than they used to be. I think what he's talking about, because I've seen him discussing on other pages, was locked during the day. I mean, you were here, not necessarily as chief, but you were here during the summer. Who locks that during? Because it locks overnight. Does it
The
not?
police department is not involved in locking or unlocking the
Yeah,
gate.
same here.
I wonder who does it. So that's the answer is, as far as you guys know, it has nothing to do with COVID. It's just not been unlocked yet, pretty much. So,
Yeah.
all right, Dave, if you're listening, I would try to find out through the Board of Selectmen, see who the rep is
Town
for.
administrator.
Maybe
or,
Matt Lepore might know from the Conservation Committee to find out when and if that gate's going to be unlocked. Like Chief said, not trying to stop people from kayaking, but it's not a huge parking lot down there. And if everybody tries to go kayaking at once, you know, might be a bit of a problem. At least I don't want to answer your question for you, but that would be what I gather from that.
So some of that's also the river levels. They don't want to open it when the river's high and create, a risk. But
That's true, especially with the rain we've been having.
Mhm.
Steve Weber has chimed in on the river access, but let me go to one comment before him. Louise Hobden, thanks you both for your service for the town.
Thank you kindly.
Steve Weber from the chairman of the Board of Selectmen says the river access is not closed. We just have not opened it yet. We'll be beginning with LFD, Fire Rescue, for assessment of the river height, like you said. And if it's safe to open, they'll open. So there's your answer, Dave. It just hasn't something they've looked at yet. They're going to get to it soon. Obviously, there are other pressing matters in town, but hopefully the water level is low enough. Nobody is looking to close that permanently. So looks like it'll be open, relatively soon, pending the water. Let's go back to our questions here. Keep them coming, everyone. All right. Disinfect. I guess this goes to more for Chief Sergeant. In your opinion, as you and your officers drive around town, how is Litchfield done with social distancing? And then I'll give you the same question.
In my opinion, based on my observations, speaking with Sergeant Dennis Tessier this evening and Dispatcher Kaylee Lemieux, I wanted to learn if I had missed any calls where we had a report of a large gathering, if there are any concerns, if there are any warnings being issued for violation of the governor's orders. And I was advised that there had not. Very early on, someone had reported multiple vehicles at one residence in town. It was all people who resided at the home. So I do believe that people are being cautious. They're doing a good job social distancing. I would encourage them to continue those safe practices, and I think they're doing a really good job.
You don't drive around as much, but if you feel
So
the same
I
way.
know early on, as part of our emergency management meetings, we fielded some concerns with groups, and particularly again the basketball and pickup football games and so forth. But that was really very early on in the whole thing, and we haven't had really any concerns as of late. I know for the most part, any observations I've made for the most part on Albuquerque with the bike path. There's, I don't think I've ever driven up or down Albuquerque and not seen someone on the bike path, which is awesome. But there are one or two people walking dogs. They're clearly related and most likely I would assume in the same household. So the 6 foot thing is a little bit of a,
Right.
but no groups of people up and down the bike path. I think it's very good, and I would encourage people to let's keep it that way and do our part.
This is for probably more of Chief Sergeant. As far as the vehicle registration policies and inspections, I talked to someone who was under the impression that we're not the police aren't really looking to pull people over for that type of thing right now. The fire chief told us a little bit about inspections, registrations being the 20-day plates being pushed out a little bit. Can you talk about those kinds of violations if your registration is expired or inspections? Is that something that you're getting a little leeway here, or is it business as usual?
My direction to the officers were to utilize their discretion in terms of motor vehicle enforcement. Certainly, these are violations that could be addressed in other ways. There's opportunity to make contact with people. You could run their registration, realize that they're a local resident, and recognize that their inspection sticker was expired by 4 months. And you could certainly give them a call on the phone if we have their phone number, inside our record system. So I think the officers have done a great job in utilizing discretion for if there's egregious violations, they're going to conduct a motor vehicle stop. They're going to do it safely and with new practices that are very different than how we would normally operate. So I wouldn't say it's business as normal. I think traffic stops in general are down. But I think it also speaks to our community members who are compliant with obeying speed limits, obeying traffic laws. So I think that speaks to the people of this town that don't put the officers in a situation where they feel that they need to make contact and make these stops for minor violations.
Excellent. So to jump on that, as far as business as usual, the animal control officer is still business as usual for what he does. And it's the school resource officers who aren't at the schools anymore. They just, roll in and just do normal stuff that they would normally do.
So they've been tasked to the patrol force. However, they are in constant contact with the school administration to keep the communication open and to assist in any concerns they have. There have been a couple of times where they recognize maybe a student hasn't been as engaged in the learning process as they could be, and our school resource officers who have connections with our students have reached out to the families or the student directly to kind of get them focused and get them on the right path. So they're still working with the school. They're still handling juvenile offenses, but essentially they are assigned as a patrol unit.
So the school isn't calling the cops on some kid who's not doing their homework. It's because they have a previous relationship with
Correct.
that kid. So he's trying to help out in the situation and assess if it needs any other kind of support.
Certainly, yeah, by no means are they calling us to.
Right. I just wanted to make sure that everybody understood that. 'cause
Correct,
you know how
correct.
that
And
goes.
I think it speaks to the good relationship that the SROs or school resource officers have maintained and obtained with the school officials, where they could say, hey, we think this person, or could you go check? We haven't heard from a student in a week or two, and we're able to be mobile and go make contact and let them know that the student is okay, or help get the message back and forth. So yeah, I think it's a really good thing. I think it speaks to the collaborative effort between the agencies representing the town.
As far as people, you getting calls for people that live out of town to check on the maybe elderly relatives or relatives that live alone. Probably that's something that your department would handle. Do you have an increase of those, or is it looking like Litchfield, the good neighbor policy that we have is kind of taking care of that? Have we run any of that? Any welfare checks, making sure everybody is?
Well, I think you hit the nail right on the head with, the community takes care of its own. We had put a program out very early on within the first week or so of the whole stay-at-home policy, and got it out through social media and so forth, that if you had, a neighbor or someone you wanted us to check up on, wanted the town to check up on a daily or every other day basis, to please let us know. And I believe we're still at one person on that list. So, I look at that as there's probably a few more out there, but they're obviously people are taking care of their older neighbors or their neighbors that are in that critical over the age of 60, have the high risk category.
Okay.
And they're getting them their groceries or taking care of them. So we've really only had one person identified to be checking up on a regular basis. So, and I don't know about out of state or out of town type things, but I don't know if you guys could.
We do field some welfare check calls, nothing out of the norm. Typically you might have a family member who does live out of state, and they're trying to reach out to a loved one, and the phone is busy or there's no answer, and we make contact with the person, and so far everything's been good. They're okay. The phone lines were down. The phone was off the hook or whatnot. So I wouldn't say that we've seen a great increase in welfare checks.
My mom does that. She gets all these phones from track phones. So she has like 6 phone numbers, that any 6 phone numbers she could be calling me from, and she doesn't ever hang up. So her minutes. So there'll be days I'm trying to call her and I can't get through to any of her 6 cell phones. But I just drive over there. So I bet you run into that quite a bit. People with their track phones running out of minutes.
I think with texting, cell phones, social media, we're so much more just in general in contact
Right.
with one another that, gone are the days of, well, I haven't talked to mom in 3 or 4 days. I wonder if she's okay. I mean, it's just so common now to exchange a text or something, or, a post on Facebook that, oh, okay, she's, she posted today, she must be okay, and
Right.
type thing.
I'm going to give everybody one last chance to get in your comments and questions. I have just normal, basic questions just to wrap it up here with the Chiefs. Thanks, guys, for being here. The last two questions I had, I'm just going to wrap them together. And we'll start with Chief Freites. As far as you have any last comments, and with that, what else can the community do to help support you guys?
So before I answer that, I want to just touch on something you brought up earlier. And as far as if either department were to have personnel impacted or had to be placed in isolation, that's been addressed at a statewide level. There's several facilities around the state that will accept police, fire, and even now healthcare workers. So that if an officer or a firefighter don't want to go home to their family, we have a place to send them. It's obviously not home, but it's a comfortable place. One of our local motels, several strategically placed around the state where they can go, have a place, get them, 3 meals a day, but not be in contact with their family. The other thing that
That's a quarantine. They're not working.
they're not working.
That's a
no.
quarantine type thing.
They're basically quarantined until such time as they're tested. The individual that they were exposed to is tested and comes back either positive or negative, and then ultimately they're tested. And that's a key point, because at one point, maybe 2 weeks ago or so, we had 150, as many as 153 first responders, police, fire, and EMS in quarantine throughout the state. So the state has been monitoring that so that no one community is impacted. And a plan's kind of been put together so that if a department has, is limited, okay, can we rely on state police or the sheriff's department to augment? On the fire side, we have, mutual aid agreements. We don't have a state fire department or county fire department that we can pull resources from, but we have our neighboring departments, or we have departments from other parts of the state that we could pull people into. But what the bigger priority was to streamline the testing for first responders. So now, if a police officer, firefighter has a potential exposure, what's considered an unprotected exposure, come upon somebody, they start coughing on you, and they get to the hospital, that first responder goes into isolation. The subject gets tested. That patient's test is expedited. That first responder can also be tested, and that test, the first responder test and the expedited test, go to the state lab and get priority. So within 24 hours, we'll know if that patient tested positive, and if so, then that first responder, whether they test positive or negative, has to be quarantined for at least a period of time, because the incubation period. But it at least allows to put personnel back to work sooner than just blanket 14 days out. We could see an individual back, on the job in 4 days, once they've cleared a 72-hour period and don't test positive in an expedited test. So that's all been put into place, and that's been through, the work of the town, the state Homeland Security, Health and Human Services, a big part Dartmouth, Hitchcock, and Lebanon, because they actually are only the second place in the state that can run testing. Everything. So it's the Health and Human Services Lab in Concord, and Dartmouth, Hitchcock, and Lebanon can actually run the tests. All the other testing is done by private labs, and I don't believe there are any in the state that do that. So, to your, what can the community do? I'm gonna sound like a broken record with everybody else that's out there, whether it's Channel 9 or the paper. Practice social distancing, wash frequently. But probably key is don't call 911 for questions, or only call it for emergencies, true emergencies. If you have questions, 211 is a state number. We'll get you. There's a call center set up in Concord that's staffed 24 hours a day. They can get you information, whether it's basic information, relay you to specific resources, and so forth. You certainly can always, during normal business hours, Monday through Friday, call the police department, fire department. We're happy to field questions and get you the resources you need. But please keep 911 to emergencies only so we don't overload the system. We already talked about checking on your neighbors, particularly those in the high risk category, over 60 or with underlying medical issues, respiratory issues, and so forth. If they need groceries, they need something, if you can get it for them, leave it on the steps. Don't take it into their house. You kind of want to keep that barrier of, if it's not your home, you shouldn't really be in it, so that you don't potentially bring something in or take something out. Again, stay home unless you need to go out for obviously work or groceries or essential needs, and get outside. We talked about, bike path, the conservation land, get outside, get some fresh air. It's good for the body. It's good for the mind. So
what can the community do to help continue to support the police department?
Well, I think the fire chief covered quite a bit about great things that they can do to help keep us safe for any interactions that we have with our community members. I think I would just ask the citizens to stay positive. I think your mental health during these hard times, these trying times, it's important to make sure that you're looking out for your mental health and knowing that there are resources out there for you. And like the fire chief said, you could reach out to 211, you could reach out to the police department. Call in, we'll talk to you, we'll get you the resources, because we understand in these trying times, it causes people to have adverse reactions, high emotions. And I think just see if you can take a step back, take a breath, think about what's happening before you make any rash decisions. I think that's important. We're concerned. So we'd ask you to stay positive. Please follow the guidelines, like the fire chief said, with social distancing, frequent washing. That's so important. We're doing it on our end too. So that's my message to the town. And you got a great emergency management team that is working hard for you. It's about Team Litchfield, like the fire chief said. It is not the fire department, the police department, the IT, the schools. We are all together. We're all together as one, and that's a really great thing for this town.
Oh, it wasn't always the way. Remember, Russ?
It's better now.
Well, I think sometimes it takes challenge to build a team and bring a team
It's
together.
like that. You pick on your little brother, you beat him up all the time. But if someone in school touches your little brother, that's a different story.
Sure.
We got one more question from somebody. She asked, I think we kind of went over it. How are the wellness checks going? Are you checking on people who have lost jobs as well as being alone with health concerns? Are concerned about their well-being? Before you guys answer it, I don't know how you could possibly go around and knock on doors and ask how everybody feels. But I know that if someone feels a little overwhelmed, as you said, they can contact either department and you guys can show them resources. Is there anything you wanted to add to that?
No, I think the only thing I would add to that is, if we don't know, we can't obviously offer help. So, please bring ideas. We're always open for suggestions, to Chief Sergeant's point, stay positive. If there's something, we've done a couple of birthday party drive-bys, just again, to try and, it helps our people. It helps them stay positive. It gives them a sense of doing something to help the community. So if there's things like that, we're happy to do it. But if we don't know, it's hard. If we find out, we'll try to address a situation. But if we don't know, so certainly, bring things forward. If somebody feels that, they know somebody that should be added to the Good Neighbor program, just call in. The dispatcher will take the information and a member of the town staff will reach out. And it may be one phone call and they say, don't call me again. I'm good. I'm all set. We'll respect that. Or it may be, we've been calling, the one individual in particular pretty much every day, if not every other day, and they enjoy it. It's gives them something to look forward to.
Can
So,
somebody call and say, I think you need to check on so-and-so and remain anonymous?
Yeah.
You don't have to?
Absolutely.
Yeah,
Absolutely.
yeah. So I think, I don't want to jump on your answer, but as far as the mental health goes, they can steer you into resources that you can get. Most therapists are still working, Zooming. There are other formats they're using because of HIPAA laws and people being able to hack into it. But don't be afraid to ask. You can call either of the departments.
Or 211. 211.
211.
is an endless amount of
It's important to
resources.
say what the chief said. It's important to know that 211 is not going to put you in robot land. There are people that are going to answer the phone. Like, I didn't know this until just now. I've heard the 211 thing. I'm like, okay, 211, it's going to say press 1 for COVID-19. It's not that way. It's people are there to answer the phone, to talk to you. Mental health, as you guys said, very important at this time. It's not just the disease that's affecting people. It's this is, like you said, nothing like this has ever happened. So if you know somebody, don't hesitate to call on their behalf. Try to get them to get help. These guys have the resources, and if it's a child, the schools have even more resources, and they can actually send someone to your house. Or if you don't have a therapist, they can have a counselor Zoom you or something. Mental health that's the kind of thing that falls through the cracks on something like this, and we definitely don't want that to happen. Is there anything you wanted to add about that?
It's just something that's very important to me. I'm very concerned for our police officers, certainly locally across the nation, our first responders, our firefighters. But again, it goes beyond, because if we have positive interactions with our citizens, if we see that we can help them, it helps us feel good about what we're doing and being accomplished and making a difference. So we're here for you, the residents, the businesses, collectively, the fire department, the police department, the town. So sometimes it's as simple as a fire truck going by with the lights and sirens away from a police officer, or hitting the air horn, little things like that to bring a smile. Maybe a quirky video that Corporal Gott puts out on a Saturday morning,
That's awesome.
singing in front of the town hall. But if that made one person's morning, then it was the right thing to do. So we're going to keep trying to do little fun things like that to bring a smile to your day, to brighten it up, and let you know we're going to get through this. We're going to get through this together at Esteem Litchfield.
All right. I think the only complaint would be to let us know next time you're having a concert. Give us a little heads up.
All right, sounds good.
Chief, thanks for being here. As we go through this, and hopefully the governor and the state tends to loosen things up, and we take things gradual and socially responsible, we'd like to have you back when that kind of thing rolls out, just to see how that kind of thing is going. Hopefully in a few weeks, hopefully as soon as
Absolutely.
possible.
Thank you.
So I guess thanks again for being here. Thanks for everyone who joined in on Facebook. If you watched it on YouTube Live or joined in on Facebook and had some comments, thanks for that. LCTV is trying to make sure that we have something new as much as we can, more content so people can watch instead of the Tiger King 5 or 6 times. So we're here for you to put out some content and to do some interviews with some people in town where their lives are changing and their businesses are changing. And of course, the most important kind of interviews is the ones with your public servants. So thanks again for being here. Thanks, Russ, over there on the Wheels of Steel, DJ Russ. Thanks for
And behind the scenes.
yeah. Thanks, Chief Freitzel,
Freitzel.
and Chief Sergeant for being with us today. And I guess we'll see you some other time.
Thank you
Thanks for being here.
Thank you.
for the opportunity.
Stay safe.